and acknowledging the commonality of C-sections in childbirth. 2. Immediate post-op care. Discuss the importance of following medical advice for wound care and pain management. Highlight the significance of rest and limited physical activity in the initial days. 3. Incision care. Explain how to clean and care for the incision site. Stress the significance of keeping the incision dry and watching for signs of infection. 4. Pain management. Talk about prescribed pain medications and their proper usage. Suggest non-pharmacological methods like using a heating pad or practicing deep breathing exercises. 5. Activity guidelines. Emphasize the need for gradual reintroduction of daily activities. Recommend avoiding heavy lifting and strenuous exercise until approved by a healthcare professional. 6. Nutrition and hydration. Highlight the importance of maintaining a healthy diet for recovery. Encourage staying hydrated to aid in healing. 7. Monitoring postpartum bleeding. Discuss what is considered normal postpartum bleeding and when to seek medical attention. 8. Emotional well-being. Address the emotional aspects of recovery and potential postpartum emotions. Encourage open communication with healthcare providers about mental health concerns. 9. Follow-up appointments. Stress the importance of attending postoperative checkups. Explain what to expect during these appointments and how healthcare providers monitor recovery. 10. Support system. Discuss the role of family and friends in providing support. Emphasize the importance of seeking help when needed. 11. Breastfeeding after C-section. Offer guidance on breastfeeding positions that are comfortable post-surgery. Highlight the benefits of breastfeeding for both the mother and baby. 12. Scar massage. Introduce scar massage as a technique to promote healing and reduce scar tissue. Demonstrate gentle massage techniques. 13. Resuming intimacy. Discuss the importance of waiting until physically and emotionally ready. Provide tips for comfortable intimacy post-C-section. 14. Postpartum exercise guidelines. Explain when it's safe to start postpartum exercises. Offer examples of gentle exercises to aid in recovery. 15. Birth control options. Discuss contraceptive options suitable for post-C-section recovery. Encourage discussions with healthcare providers about family planning. 16. Warning signs. Outline potential complications and the importance of recognizing warning signs. Stress the need to seek immediate medical attention for any concerning symptoms. 17. Scar appearance. Address common concerns about the appearance of the scar. Provide reassurance that scars tend to fade over time. 18. Returning to work. Discuss factors to consider when planning a return to work. Emphasize the importance of balancing work responsibilities with ongoing recovery needs. 19. Long-term care considerations. Mention the potential for future pregnancies and how that may impact the C-section scar. Discuss any long-term considerations or precautions advised by healthcare professionals. 20. Conclusion. Summarize key points. Encourage viewers to consult with their healthcare providers for personalized advice. Remember to tailor the script to your audience and provide a disclaimer to consult with healthcare professionals for personalized advice.
Hello and welcome to our video about the 21 weeks of pregnancy symptom and baby development. In this video, we'll be discussing the changes that are happening in your baby's development and what you can expect during this stage of your pregnancy. Firstly, let's talk about your baby's development. At 21 weeks, your baby is about the size of a carrot, weighing around 360 grams and measuring around 26.7 centimeters long from head to heel. During this stage of development, your baby's body is growing rapidly, and they are developing more defined features. Their eyelids and eyebrows are forming, and their fingernails and toenails are growing. Your baby's brain is also growing rapidly during this stage of development. They are developing more neural connections, which will continue to develop after birth. Your baby is also starting to develop their senses, such as taste, touch, and hearing. They can now hear sounds from outside the womb, so it's a good idea to start talking and singing to your baby to help them recognize your voice. Now let's talk about the symptoms you may experience during this stage of your pregnancy. Firstly, you may start to notice that your belly is getting bigger. As your baby grows, your uterus will expand to accommodate their growth. This can cause some discomfort and may make it more difficult to find a comfortable sleeping position. You may also start to experience some back pain, as the weight of your growing baby can put pressure on your back muscles. To help alleviate this, you can try doing some prenatal exercises that focus on strengthening your back muscles. You can also try using a pregnancy pillow to support your back while you sleep. Another symptom you may experience is heartburn. As your baby grows, they can push your stomach upwards, causing stomach acid to leak into your esophagus. This can cause a burning sensation in your chest and throat. To help alleviate this, try eating smaller, more frequent meals throughout the day, and avoid spicy or greasy foods. You may also notice that your skin is changing during this stage of your pregnancy. Your skin may become more sensitive, and you may develop stretch marks as your belly expands. To help prevent stretch marks, try using a moisturizing lotion on your belly and other areas of your body that may be prone to stretching. Finally, you may start to feel your baby moving more during this stage of your pregnancy. This is a great sign that your baby is healthy and growing. You may feel kicks, punches, or rolls, which can be a fun and exciting experience. As your baby grows, their movements will become more frequent and stronger. In conclusion, at 21 weeks, your baby is growing rapidly and developing more defined features. You may experience some discomfort, such as back pain and heartburn, as your body adjusts to your growing baby. However, feeling your baby move is a wonderful and exciting experience, and a sign that they are healthy and growing. Thank you for watching our video about the 21 weeks of pregnancy symptom and baby development. Please subscribe to our channel for more helpful videos about pregnancy and parenting.
Hello everyone, welcome back to our pregnancy journey. Today, we're going to talk about week 22 of pregnancy, including the symptoms you might be experiencing, as well as the exciting developments happening with your baby. Symptoms. At week 22, you might be feeling some new and different symptoms compared to the previous weeks. Here are some common symptoms you may experience. Braxton Hicks contractions. These are mild contractions that may start to occur in the second trimester. These contractions help prepare your uterus for labor and delivery. Backaches. As your baby grows, your center of gravity shifts, which can cause strain on your back muscles. Be sure to practice good posture and stretch regularly to help alleviate back pain. Leg cramps. You may experience painful leg cramps due to the additional weight you're carrying. Stretching and gentle exercise can help prevent these cramps. Swollen feet and ankles. Your body is retaining more fluids during pregnancy, which can cause swelling in your feet and ankles. Try to elevate your feet when possible and wear comfortable shoes. Baby development. Now, let's talk about the exciting developments happening with your baby at week 22. Your baby is now about 11 inches long and weighs around 1 pound. They are roughly the size of a papaya. Your baby's taste buds are developing, and they can now taste the amniotic fluid. This is the fluid that surrounds your baby in the womb and provides them with nourishment. Your baby's brain is growing rapidly, and they are developing more advanced neurological connections. This means that they can now respond to sound and light, and they may even start to recognize your voice. Your baby's digestive system is starting to function, and they are practicing swallowing amniotic fluid. This helps them prepare for feeding after birth. Your baby's eyes are now fully formed, and they can blink and move them around. They are also developing more pigment in their eyes, which will determine their eye color. Conclusion. So, there you have it, week 22 of pregnancy. As your pregnancy progresses, be sure to take care of yourself and your growing baby. Attend your prenatal appointments, eat a healthy and balanced diet, and stay active with exercise that is safe for pregnancy. And most importantly, enjoy this special time in your life as you prepare to welcome your little one into the world. Thank you for watching, and we'll see you next time. Hello and welcome back to our pregnancy series. In this video, we will be discussing the 23rd week of pregnancy, including the symptoms you may experience and the development of your growing baby. Symptoms: at 23 weeks pregnant, you may start to experience some new symptoms. One common symptom is increased fatigue. Your body is working hard to support your growing baby, which can leave you feeling more tired than usual. It's important to listen to your body and get plenty of rest during this time. You may also experience some discomfort as your uterus continues to expand. This can lead to back pain, pelvic pain, and even leg cramps. Gentle stretches and prenatal yoga can help alleviate these symptoms. Some women may also notice an increase in vaginal discharge at this stage of pregnancy. As long as it's not accompanied by itching or a foul odor, this is typically normal. Baby development. Now, let's talk about your baby's development at 23 weeks. Your baby is now about the size of a large mango, measuring around 11 inches from head to toe and weighing around 1.1 pounds. Your baby's hearing is developing rapidly at this stage, and they can now hear sounds from outside the womb. This means that your baby can hear your voice, so it's a great time to start talking or singing to your growing little one. Your baby's skin is also starting to thicken and become more opaque, although they still have a long way to go before they develop the protective layer of fat that will keep them warm after birth. Your baby's lungs are continuing to mature, and they may start practicing breathing movements by inhaling and exhaling small amounts of amniotic fluid. Finally, your baby's sense of movement and position in the womb is improving. You may start to feel more distinct kicks, punches, and even somersaults as your baby becomes more active. Conclusion: so there you have it, the 23rd week of pregnancy. Remember to take care of yourself and listen to your body's needs, and don't forget to talk to your baby and enjoy the special bond that's forming between you. We hope you found this video informative and helpful. Please subscribe to our channel for more pregnancy updates, and we'll see you in the next one.
Hello and welcome to this week's update. If you're 24 weeks pregnant, congratulations, you've made it to the 6-month mark. Let's take a look at what you and your baby can expect during this exciting time. Symptoms: as you near the end of your second trimester, you may start to experience some new or intensified symptoms. Here are a few common ones. Braxton Hicks contractions. You may start to feel mild, painless contractions that come and go. These are a normal part of pregnancy and help prepare your body for labor. Shortness of breath. Your growing baby is taking up more space in your uterus, which can put pressure on your lungs and make it harder to breathe. Heartburn. The hormones in your body that relax your muscles to prepare for childbirth can also relax the valve that separates your esophagus from your stomach, leading to heartburn. Trouble sleeping. As your belly grows, it can be harder to get comfortable at night. You may also be experiencing vivid dreams or nightmares. Baby development. Your baby is growing and developing rapidly during week 24 of pregnancy. Here are some of the exciting things happening. Size. Your baby is now about the size of an ear of corn, measuring around 11.8 inches long and weighing about 1.3 pounds. Brain development. Your baby's brain is growing quickly and developing more complex neural connections. Lung development. Your baby's lungs are producing surfactant, a substance that helps the lungs expand and contract properly. Sensory development. Your baby's senses are becoming more refined, and they can now hear your voice and other sounds outside the womb. Movement. Your baby is becoming more active and may be able to kick, twist, and turn in the womb. Tips for the week. Stay hydrated. Drinking plenty of water can help reduce swelling and keep you feeling energized. Sleep on your left side. Sleeping on your left side can improve blood flow to the placenta and help your baby get the nutrients they need. Take breaks. If you're feeling tired or overwhelmed, don't hesitate to take a break and rest. Practice relaxation techniques. Relaxation techniques like deep breathing, meditation, or prenatal yoga can help reduce stress and promote relaxation. Start thinking about childbirth classes. Many hospitals and birthing centers offer childbirth classes that can help prepare you for labor and delivery. That's all for this week's update. If you have any questions or concerns, be sure to talk to your healthcare provider. We'll see you next week for another exciting update on your pregnancy journey. Hello and welcome to this week's pregnancy update. Today, we'll be talking about week 25 of your pregnancy, including the symptoms you may be experiencing and how your baby is developing. First, let's talk about your baby's development. At 25 weeks, your baby is now the size of a rutabaga, measuring around 13.6 inches long and weighing around 1.5 pounds. Your baby's skin is becoming more opaque and less transparent, and the blood vessels are now visible through their skin. Your baby's lungs are also continuing to develop, with air sacs starting to form. This is an important step towards being able to breathe on their own after birth. Your baby is also starting to develop their sense of touch, as the nerve endings in their skin become more sensitive. Now, let's move on to the symptoms you may be experiencing at 25 weeks. Many women find that they have more energy during this time, as their body has adjusted to the changes of pregnancy. However, you may still be experiencing some of the following symptoms. Braxton Hicks contractions. You may start to experience these practice contractions, which are your body's way of preparing for labor. Back pain. As your baby grows, your center of gravity shifts, which can cause back pain. Shortness of breath. As your uterus expands, it can put pressure on your diaphragm, making it harder to breathe. Heartburn. As your baby grows, they can put pressure on your stomach, causing acid reflux. Swelling. Your body may start to retain more water, which can cause swelling in your feet and ankles. Varicose veins. The increased pressure on your blood vessels can cause varicose veins to develop in your legs. Trouble sleeping. As your baby becomes more active, you may find it harder to get comfortable and fall asleep. It's important to remember that every woman's pregnancy is different, and you may experience some, all, or none of these symptoms. If you're concerned about any symptoms you're experiencing, be sure to talk to your healthcare provider. That's all for this week's pregnancy update. Join us next time for week 26, as we continue to track your baby's development and your pregnancy journey. Thanks for watching.
Welcome to The Incredible Journey, a comprehensive guide to 26-week pregnancy and baby development. Pregnancy is an incredible journey filled with joy, excitement, and sometimes, uncertainty. At 26 weeks pregnant, your baby is about the size of a butternut squash and is rapidly developing. In this video, we'll explore what's happening during the 26th week of pregnancy and take a closer look at your baby's physical and cognitive development. So, sit back, relax, and let's dive in. The 26th week of pregnancy is an exciting time as your baby continues to grow and develop rapidly. This week, your baby is about 14 inches long and weighs around 1.5 pounds. Your baby's senses are developing, and they are becoming more active. In this video, we will explore what's happening during the 26th week of pregnancy and take a closer look at your baby's physical and cognitive development. At 26 weeks pregnant, your baby is rapidly developing, and their senses are starting to come alive. Your baby's brain is developing rapidly, and they are becoming more aware of their surroundings. They can now hear your voice and respond to sounds, and their eyes are starting to open. Your baby is also starting to develop more fat, which will help regulate their body temperature after birth. Your body is also going through many changes during the 26th week of pregnancy. Your uterus is now about 2.5 inches above your belly button, and you may be starting to experience more Braxton Hicks contractions. These are mild, irregular contractions that prepare your body for labor. As your baby grows and your uterus expands, you may experience more aches and pains. Backaches, leg cramps, and hip pain are common at this stage of pregnancy. It's important to rest and take care of yourself during this time. That's it for this video on the 26th week of pregnancy and baby development. We hope you found this information valuable and informative. Remember, every pregnancy is different, so be sure to talk to your doctor if you have any concerns or questions. Join us next time on The Incredible Journey as we continue to explore the miracle of pregnancy and baby development.
Hello everyone, and welcome to this week's video about pregnancy symptoms and baby development at 27 weeks. At this point in your pregnancy, you're already well into your second trimester, and your baby is continuing to grow and develop at an incredible pace. Let's start by talking about some of the common pregnancy symptoms you may be experiencing at 27 weeks. One of the most noticeable changes may be the size and shape of your belly, which is likely to be much larger now than it was just a few weeks ago. You may also be experiencing some swelling in your feet and ankles, as well as back pain and discomfort as your baby continues to put pressure on your spine and pelvic area. Other common symptoms at this stage of pregnancy can include indigestion, heartburn, and constipation, as well as increased fatigue and difficulty sleeping. It's important to continue to take care of yourself during this time by eating a healthy diet, staying hydrated, and getting plenty of rest whenever possible. Now, let's talk about your baby's development at 27 weeks. At this stage, your baby is approximately 14.8 inches long and weighs around 2 pounds. Their eyes are now fully formed, and they are able to blink and open and close their eyes. They are also developing their sense of hearing and may be able to recognize your voice and other familiar sounds. Your baby's lungs are continuing to develop, and they may even be practicing breathing movements in preparation for their arrival into the world. They are also beginning to store up fat, which will help to keep them warm after they are born. Another important development at this stage is the development of your baby's brain. As your baby's brain continues to grow and develop, they may begin to exhibit more complex behaviors and movements, such as grabbing onto the umbilical cord or sucking their thumb. As your due date approaches, it's important to begin thinking about your birth plan and discussing your options with your healthcare provider. This may include deciding on whether or not to use pain medication during labor, as well as considering different birthing positions and other options that can help you to have a safe and comfortable delivery. In addition to preparing for your delivery, it's also a good idea to begin thinking about your postpartum care and support. This may include arranging for help with childcare and household tasks, as well as seeking out resources for emotional support and counseling. As always, if you have any questions or concerns about your pregnancy, it's important to talk to your healthcare provider for advice and guidance. So that's it for this week's video on pregnancy symptoms and baby development at 27 weeks. Thanks for tuning in, and we'll see you in next video. Hello everyone, and welcome back to our pregnancy journey. Today, we are at the 28-week mark, which means we are officially in the third trimester. In this video, we will discuss the symptoms you may experience at this stage of pregnancy and how your baby is developing. First, let's talk about some common symptoms you may experience during the 28th week of pregnancy. At this point, your baby is growing rapidly, which can put a lot of strain on your body. You may feel more tired than usual, and you may also experience shortness of breath as your growing baby puts pressure on your lungs. You may also experience swelling in your hands, feet, and ankles as your body retains more fluid. This is normal, but if you notice severe swelling, be sure to speak with your healthcare provider as it can be a sign of preeclampsia, a serious pregnancy complication. Heartburn and indigestion are also common during the third trimester as your growing uterus puts pressure on your stomach, leading to acid reflux. Eating small, frequent meals and avoiding spicy or acidic foods can help alleviate these symptoms. Now let's talk about your baby's development at 28 weeks. At this stage, your baby weighs around 2.5 pounds and is approximately 15 inches long. Their brain is developing rapidly, and they can now blink their eyes, which have formed fully. Your baby's lungs are also developing, and although they are not yet fully functional, they are producing surfactant, a substance that helps the lungs expand and contract. This is an important milestone in your baby's development as it prepares them for life outside the womb. Your baby's senses are also developing at this stage, and they can now hear your voice and your heartbeat. You may notice that your baby becomes more active when you talk or sing to them. As your baby continues to grow, they will start to gain more fat, which will help regulate their body temperature after birth. They will also continue to practice breathing, and by the end of the 3rd trimester, they will be able to hiccup. So, what can you expect during the rest of the 3rd trimester? As your due date approaches, you may experience more intense Braxton Hicks contractions, which are practice contractions that help prepare your body for labor. You may also notice an increase in vaginal discharge, which is normal but should not have a strong odor or be accompanied by itching or burning. It is also important to start preparing for labor and delivery. Talk with your healthcare provider about your birth plan and attend childbirth education classes to learn about the different stages of labor and coping techniques for pain. In summary, at 28 weeks pregnant, you may experience symptoms such as fatigue, shortness of breath, and swelling. Your baby is rapidly growing and developing, and they can now hear your voice and blink their eyes. As you move into the 3rd trimester, be sure to continue monitoring your symptoms and preparing for labor and delivery. That's all for today's video. Thank you for watching, and be sure to subscribe to our channel for more pregnancy updates.
Hello, and welcome back to our pregnancy journey. Today we're going to talk about the 29th week of pregnancy and what you can expect for both your baby's development and your own body changes. Let's start with your baby. At this point, your little one is roughly the size of a butternut squash, weighing in at around 2.5 pounds and measuring about 15 inches long from head to toe. Your baby's brain is continuing to develop rapidly, and their lungs are starting to produce surfactant, a substance that helps them breathe on their own outside of the womb. Your baby's movements are becoming more pronounced, and you may start to notice a pattern of when they are most active. They are also starting to develop their sense of taste and can taste the amniotic fluid they swallow. Now, let's talk about your body changes. At 29 weeks pregnant, you may notice that your belly is getting bigger, and you're feeling more and more pregnant every day. As your uterus continues to expand, you may experience some discomfort or even pain in your lower back, hips, or pelvis. This is normal, but if you're concerned, talk to your healthcare provider. You may also notice some new symptoms, such as Braxton Hicks contractions. These are practice contractions that feel like your uterus is tightening and releasing. They're usually painless and irregular, but if you're experiencing them frequently or with any pain or discomfort, it's important to let your healthcare provider know. Other common symptoms at this stage of pregnancy include shortness of breath, heartburn, and difficulty sleeping. If you're having trouble sleeping, try sleeping on your left side with a pillow between your knees to support your lower back and hips. It's also important to keep up with your prenatal appointments and any recommended tests or screenings. At your 29-week appointment, your healthcare provider may check your blood pressure, measure your belly, and listen to your baby's heartbeat. As you enter the 3rd trimester of pregnancy, it's important to continue taking care of yourself and your growing baby. This means eating a healthy, balanced diet, staying hydrated, and getting regular exercise. Walking, swimming, and prenatal yoga are great options for staying active during pregnancy. It's also important to prepare for your baby's arrival. Start thinking about your birth plan and what kind of experience you want. Consider taking a childbirth education class which can help you feel more prepared and confident about labor and delivery. In addition to preparing for the birth, you'll want to start thinking about what you'll need for your baby's arrival. This includes things like a car seat, crib, diapers, and clothing. Overall, the 29th week of pregnancy is an exciting time as your baby continues to grow and develop. As always, if you have any concerns or questions, don't hesitate to reach out to your healthcare provider. Thank you for tuning in, and we'll see you next time for another update on your pregnancy journey. Hello and welcome to this video about 30 weeks of pregnancy and baby development. This is an exciting time for both the mother and baby as there are many changes happening. In this video, we will discuss the baby's development, the mother's physical changes, and how to take care of yourself during this period. Baby development. At 30 weeks of pregnancy, the baby is about the size of a cucumber and weighs around 3 pounds. Here are some key developments happening at this stage. Brain development. The baby's brain is growing rapidly, and the cerebral cortex is developing, which is responsible for controlling movement, sensation, and perception. Lung development. The lungs are almost fully developed, and the baby is practicing breathing movements, which will help them breathe on their own after birth. Fat deposits. The baby is accumulating fat deposits under the skin, which will help regulate their body temperature and provide energy after birth. Sensory development. The baby's senses are becoming more refined, and they can recognize sounds, light, and even taste. Movement. The baby is quite active and can move around, kick, and even hiccup. You may feel their movements quite strongly at this stage. Mother's physical changes. As the baby grows, the mother's body will also go through many changes. Here are some of the most common physical changes at 30 weeks. Weight gain. Most women will have gained around 20 to 25 pounds by this stage of pregnancy. The weight gain is essential for the baby's growth and development. Braxton Hicks contractions. These are mild contractions that may be felt in the uterus. They are not usually painful and are a sign that the uterus is preparing for labor. Stretch marks. The skin around the abdomen may begin to stretch, causing stretch marks. These usually fade after pregnancy. Fatigue. As the baby grows, the mother may feel more tired and require more rest. Shortness of breath. The growing baby can put pressure on the diaphragm, making it harder to breathe deeply. Taking care of yourself. It's essential to take care of yourself during pregnancy to ensure both you and your baby stay healthy. Here are some tips for staying healthy during the 30th week of pregnancy. Eat a healthy diet. Make sure you are eating a balanced diet that includes plenty of fruits, vegetables, and lean. Avoid foods that are high in symptoms could be indicators of an exciting journey ahead. Point 1. Missed period. One of the most common early signs is a missed period. The absence of your regular menstrual cycle could signal pregnancy. Point 2. Breast changes. Pay attention to changes in your breasts. Increased sensitivity, tenderness, and darkening of the areolas might occur. Point 3. Fatigue. Feeling unusually tired or exhausted. Pregnancy hormones can cause fatigue. Point 4. Nausea and morning sickness. Many pregnant women experience nausea, often referred to as morning sickness. It can occur at any time of day and might be triggered by certain smells or foods. Point 5. Frequent urination. Have you noticed yourself visiting the bathroom more often? Pregnancy can lead to increased urination due to hormonal changes. Point 6. Food aversions and cravings. Your taste preferences might suddenly change. Cravings for specific foods or aversions to others could be a sign. Point 7. Mood swings. Hormonal fluctuations during early pregnancy can impact your mood. Don't be surprised if you find yourself feeling emotional or irritable. Point 8. Abdominal bloating. Some women experience bloating or a feeling of fullness in the abdomen. It could be attributed to changes in hormones and digestion. Point 9. Increased basal body temperature. If you've been tracking your temperature, you might notice a sustained rise. This can indicate pregnancy, but it's important to track consistently. Point 10. Implantation. Bleeding. Spotting or light bleeding might occur when the fertilized egg attaches to the uterine lining. It's often mistaken for a light period. Conclusion. Keep in mind that these symptoms can vary widely among individuals. If you suspect you might be pregnant, it's always a good idea to take a home pregnancy test or consult with a healthcare professional for accurate guidance. Outro. Thanks for joining us today. If you found this video helpful, don't forget to hit that like button and subscribe for more informative content. Remember, every pregnancy journey is unique, so stay informed and take care of yourself. Until next time.
Title: Managing Pregnancy Weight Gain 20 Tips for a Healthy Journey. 1. Introduction. Welcome viewers and address the importance of managing weight during pregnancy. 2. Consult your healthcare provider. Emphasize the significance of consulting with a healthcare professional before making any changes. 3. Understand healthy weight gain range. Explain the recommended weight gain range based on pre-pregnancy BMI. Balanced nutrition. Stress the importance of a well-balanced diet, including fruits, vegetables, whole grains, and lean proteins. 5. Stay hydrated. Remind viewers to stay hydrated by drinking plenty of water throughout the day. 6. Regular exercise. Highlight safe exercises during pregnancy, such as walking, swimming, and prenatal yoga. 7. Monitor portion sizes. Discuss the significance of portion control to avoid overeating. 8. Choose nutrient-dense foods. Encourage the consumption of nutrient-dense foods for both the baby's and mother's health. 9. Limit added sugars and processed foods. Advise viewers to minimize the intake of added sugars and processed foods for a healthier pregnancy. 10. Include healthy snacks. Suggest healthy snack options to curb cravings without compromising nutrition. 11. Listen to your body. Encourage women to pay attention to hunger and fullness cues. 12. Weight monitoring. Discuss the importance of regular weight monitoring under the guidance of healthcare professionals. 13. Manage stress. Address the impact of stress on weight and provide tips for stress management during pregnancy. 14. Adequate sleep. Emphasize the importance of sufficient sleep for overall well-being. 15. Support system. Highlight the role of a supportive network during pregnancy. 16. Educate on gestational diabetes. Discuss the link between gestational diabetes and weight and ways to manage it. 17. Limit caffeine intake. Remind viewers to moderate their caffeine intake during pregnancy. 18. Healthy cooking methods. Encourage the use of healthy cooking methods like grilling, steaming, or baking. 19. Postpartum planning. Discuss the importance of postpartum planning for a smooth transition and healthy lifestyle continuation. 20. Celebrate non-scale victories. Encourage celebrating accomplishments beyond the scale, focusing on overall health and well-being. Conclusion. Summarize the key points and express encouragement for a healthy pregnancy journey. Remember to tailor the script to your audience and consult with healthcare professionals for personalized advice.
Welcome back to our channel. Today, we're diving into the topic of normal delivery and discussing whether it's the right choice for expecting mothers. Giving birth is a transformative experience, and there are various methods available. Let us explore the pros and cons of opting for a normal delivery. Point 1. Natural process. Host. Normal delivery, also known as vaginal birth, is a natural process that has been practiced for centuries. Many argue that it is the way our bodies are designed to bring new life into the world. Pro. Natural process. Normal delivery allows the mother to experience the natural progression of labor, which can enhance the bond between mother and child. It also allows the mother's body to release hormones, such as oxytocin, which aid in breastfeeding and postpartum. Recovery. Con. Pain and discomfort. While normal delivery is a natural process, it can involve intense pain and discomfort during labor. This can be challenging for some women, and pain management techniques like breathing exercises and epidurals may be faster recovery. Host. Another aspect to consider is the recovery period after childbirth. Let us take a closer look at the pros and cons related to recovery. Pro. Faster recovery. Compared to a cesarean section, normal delivery typically results in a shorter hospital stay and faster postpartum recovery.
Women who have a normal delivery may find it easier to resume their daily activities and care for their newborn. Con. Physical trauma. Despite the faster recovery, normal delivery can cause physical trauma, such as perineal tears. Recovery from these tears can take time and require additional care and attention. Point 3. Lower risk of complications. Host. Ensuring the safety of both the mother and baby during childbirth is a top priority. Let us discuss the pros and cons associated with the risk of complications. Pro. Lower risk of complications. In many cases, normal delivery is considered a safer option compared to cesarean sections. It carries a lower risk of infection, blood loss, and complications related to anesthesia. It also promotes natural immune system development for the newborn. Con. Unpredictability. Normal delivery is not without risks. Complications such as umbilical cord prolapse or shoulder dystocia can occur during labor. These situations require immediate medical intervention to ensure the well-being of both mother and baby. Point 4. Support and guidance. Host. Having a strong support system and access to guidance is crucial during childbirth. Let us explore the pros and cons related to support and guidance during normal delivery. Pro. Emotional support. Many women find comfort and reassurance in having their loved ones present during labor. The support of a partner, family members, or a doula can help alleviate anxiety and provide encouragement. Con. Limited control. While having a support system is beneficial, the process of normal delivery can sometimes be unpredictable. This lack of control can be challenging for some women, leading to increased stress and anxiety. Conclusion. Host. In conclusion, the decision to opt for a normal delivery or any other birthing method is a personal one that should be made after careful consideration. Let us summarize the pros and cons we've discussed. Normal delivery is a natural process that promotes the release of beneficial hormones and strengthens the mother-child bond. Faster recovery and shorter hospital stay are advantages of normal delivery, but physical trauma such as perineal tears may occur. Emotional support during labor can be comforting, but the lack of control in the process can cause stress and anxiety. Remember, every pregnancy is unique, and it's essential to consult with healthcare professionals to make an informed decision. We hope this video has provided you with valuable insights to help you make the best choice for yourself and your baby. Don't forget to like and subscribe.
Boy symptoms during pregnancy. Most common sign of baby boy. 1. Pregnancy, a natural process of childbirth, often leads to speculation among family and friends regarding the baby's gender. 2. In this video, we'll explore common symptoms associated with carrying a baby boy during pregnancy. 3. New viewers are encouraged to subscribe to the channel for more informative content on pregnancy. 4. Hormonal changes during pregnancy can occur regardless of the baby's gender, affecting various aspects of a woman's body. 5. Increased acne during pregnancy is often associated with the likelihood of carrying a baby boy. 6. Cravings for salty and sour foods are believed to indicate a higher chance of carrying a baby boy. 7. Pregnant women can indulge in cravings while prioritizing healthy and safe food choices. 8. A low abdomen pregnancy belly is considered a symptom of carrying a baby boy. 9. Women carrying boys may have a pregnant belly positioned closer to their pelvis. 10. Changes in urine color may serve as an indicator of the baby's gender, with darker urine suggesting a higher likelihood of a baby boy. 11. Breast size changes during pregnancy, with a common perception that the right breast is larger than the left when carrying a boy. 12. Cold hands and feet in pregnant women are often interpreted as a sign of carrying a baby boy. 13. Dry hands, despite applying lotion, may indicate the presence of a baby boy in the womb. 14. Hormonal changes during pregnancy can affect hair growth, with accelerated growth potentially signaling the presence of a baby boy. 15. Weight gain is a typical occurrence during pregnancy, but a significant pregnant belly with minimal weight gain elsewhere may suggest carrying a baby boy.
Introduction. Emphasize the transformative journey of pregnancy. Discuss the emotional and physical changes women experience. Calculating weeks. Clarify that the LMP method is a standard for tracking pregnancy. Note that not all months have the same number of days, so weeks may not align perfectly. Month-to-week conversion. Break down weeks further, explaining the significance of each week. Highlight milestones like the baby's heartbeat starting around week 6. Trimesters. Detail major developments in each trimester, such as organ formation and fetal movement. Discuss common symptoms and changes experienced by the mother. Due date calculation. Explain the Naegele's rule for estimating the due date. Stress the importance of ultrasounds for accurate dating and monitoring fetal growth. Common pregnancy terms. Elaborate on terms like term, preterm, and postterm. Discuss the potential challenges and care associated with preterm births. Tips for tracking. Recommend apps that provide daily insights and tips. Suggest creating a pregnancy journal to document experiences and questions for healthcare providers. Closing. Reinforce the uniqueness of each pregnancy journey. Express support for viewers going through this experience. Disclaimer. Emphasize that the provided information is general and may not cover specific cases. Encourage seeking professional advice for personalized guidance. Call to action. Ask viewers to share their pregnancy stories or questions. Remind them to consult healthcare providers for accurate and personalized information.
Intro. Hey there, amazing viewers! Welcome back to our channel. Today, we have a topic that's close to the heart: pregnancy and self-care tips. Whether you're expecting, planning to be, or just curious, you're in for a treat. Stick around for the top 15 points that'll make your pregnancy journey a breeze. Point 1. Mindful nutrition. First up, let's talk about nourishing yourself and your little one. Opt for nutrient-rich foods, plenty of fruits and veggies, and don't forget that hydration game. Point 2. Gentle exercises. Next on the list is staying active, but no need for intense workouts. Gentle exercises like prenatal yoga or a simple stroll can do wonders for your well-being. Point 3. Beauty of rest. Ah, the beauty of rest. Embrace those power naps and full night's sleep. Your body and mind will thank you. Trust me. Point 4. Emotional wellness. It's okay to have mixed emotions. Prioritize your emotional well-being, whether through journaling, meditation, or just having heart-to-heart talks. Point 5. Pamper yourself, pamper time, treat yourself to a relaxing bath, a prenatal massage, or whatever makes you feel like that you are. Point 6. Support system. Surround yourself with positivity. Your support system is crucial. Friends, family, or fellow mom-to-be pals. Point 7. Educate yourself. Knowledge is power. Educate yourself about the beautiful journey you're on. Attend prenatal classes, read books, and absorb all the information. Point 8. Regular checkups. Speaking of information, regular checkups are a must. Keep track of your and your baby's health with those scheduled visits to your healthcare provider. Point 9. Fashionable comfort. Who says you can't be fashionable and comfortable? Invest in maternity where that makes you feel good and accommodates that growing belly. Point 10. Hygiene essentials. Pay extra attention to hygiene. A healthy baby. It's the little things that count. Point 11. Positive affirmations. Daily affirmations are like a power boost for your mindset. Remind yourself of the amazing journey you're on and the incredible mom you're becoming. Point 12. Create memories. Capture those beautiful moments. Whether it's through a pregnancy photo shoot or a simple diary, create memories that'll last a lifetime. Point 13. Delegate tasks. Don't be shy to ask for help. Delegate tasks and focus on what truly matters, your well-being and your baby's. Point 14. Stay flexible. Plans might change, and that's okay. Stay flexible and adapt to the beautiful uncertainties of this journey. Point 15. Celebrate milestones. Last but not least, celebrate the milestones. Every kick, every ultrasound, it's all part of your incredible story. Outro. And there you have it, the top 15 points for a happy and healthy pregnancy. If you enjoyed this video, don't forget to give it a thumbs up, subscribe, and hit that notification bell. Until next time, take care of yourself and that precious bump. Sending lots of love.
Understanding Miscarriages, a comprehensive guide. 1. Introduction. Welcome to today's video, where we'll be delving into the sensitive topic of miscarriages. Miscarriage, the natural death of a fetus before viability, usually within the first 20 weeks of pregnancy, is a subject that affects many expecting parents. 2. Definition and prevalence. Medically termed as spontaneous abortion, miscarriage is one of the most common pregnancy-related issues. According to the American College of Obstetricians and Gynecologists, ECOG, approximately 15% to 20% of clinically recognized pregnancies end in miscarriage. 3. Impact and trauma. While miscarriage is relatively common, it can be an incredibly traumatic and devastating experience for individuals and couples. Many women may even experience a miscarriage before they realize they are pregnant or before it's confirmed by a healthcare provider. 4. Risk factors and predicted risks. The risk of miscarriage varies depending on factors such as age and previous miscarriages. For women under 35, the risk is around 10%, while for those over 40, it rises to about 45%. 5. Types of miscarriages. Miscarriages can manifest in different types, including threatened, incomplete, complete, missed, and recurrent miscarriages. Each type presents unique symptoms and challenges. 6. Causes of miscarriage. While many women blame themselves, most miscarriages occur due to reasons beyond their control. Common causes include chromosomal abnormalities, weakened cervix, uterine abnormalities, and underlying health conditions. 7. Risk factors and symptoms. Factors such as obesity, advanced maternal age, previous miscarriages, and substance abuse can increase the risk of miscarriage. Symptoms may include vaginal bleeding, abdominal cramps, pelvic pain, and the disappearance of pregnancy symptoms. 8. Diagnosis and prevention. Miscarriages are diagnosed through tests such as transvaginal ultrasound, blood tests, and pelvic exams. While most miscarriages cannot be prevented, steps can be taken to promote a healthy pregnancy, including maintaining a healthy lifestyle, attending prenatal appointments, and discussing concerns with a healthcare provider. 9. Conclusion and call to action. Thank you for joining us as we explored the sensitive topic of miscarriages. If you found this video informative, please remember to like, share, and subscribe to our channel for more educational content. Together, let's raise awareness and support individuals and families navigating the complexities of pregnancy loss. 10. Outro. Until next time, take care and remember, you're not alone in your journey.
Conceiving with PCOS, 20 tips for a successful pregnancy journey. 1. Introduction. Welcome to our channel. Today, we're discussing a topic that many women with polycystic ovary syndrome, PCOS, face: how to increase the chances of getting pregnant despite PCOS. 2. Understand PCOS. Briefly explain what PCOS is and its impact on fertility. 3. Consult a specialist. Point out the importance of seeking advice from a fertility specialist or gynecologist. 4. Lifestyle changes. Discuss the significance of adopting a healthy lifestyle, including a balanced diet and regular exercise. 5. Maintain a healthy weight. Highlight the connection between weight management and PCOS-related fertility issues. 6. Monitor ovulation. Explain methods for tracking ovulation, such as using ovulation predictor kits. 7. Timing intercourse. Offer guidance on the optimal timing for intercourse during the menstrual cycle. 8. Fertility-friendly diet. Suggest foods that may positively impact fertility for women with PCOS. 9. Stay hydrated. Emphasize the importance of staying hydrated for overall reproductive health. 10. Reduce stress. Discuss techniques as stress can impact. 11. Introduce supplements like folic acid and inositol that may support fertility. 12. Medications be prescribed to regulate ovulation. 13. In vitro fertilization, IVF. Touch on the option of assisted reproductive technologies like IVF. 14. Acupuncture. Mention studies suggesting acupuncture may aid fertility in women with PCOS. 15. Regular checkups. Encourage regular checkups to monitor progress and adjust strategies if needed. 16. Partners' health. Remind that male fertility is crucial and partners should maintain their health. 17. Educate yourself. Encourage women with PCOS to educate themselves on their condition and fertility. 18. Community support. Recommend joining online communities or support groups for sharing experiences. 19. Patience and persistence. Emphasize that the journey might take time and persistence is key. 20. Closing. Conclude with a message of hope, reminding viewers that many women with PCOS
14 weeks pregnant. Your baby's development. Welcome to your second trimester. Your little one is trying out some new moves this week. Your baby's eyes are starting to move, and those little legs and arms are starting to flex. These movements also allow your baby to practice the important skill of moving hands to mouth. The senses of smell and taste are also developing, and your baby's skin is thickening too. You'll have to wait and see if your baby will be born with a full head of hair or not, but right now, hair follicles are forming under the surface of the skin. With each passing week, your baby is looking more and more like the little person you'll meet the day you give birth. By now, or very soon, the genitals are fully developed. But it's still too early to know whether you're having a boy or a girl. How big is my baby at 14 weeks? At 14 weeks, your baby is growing and developing rapidly, measuring between 3.5 and 4 inches long and weighing around 2 ounces, about the size of a navel orange. The size of the fetus at 14 weeks pregnant. At 14 weeks, the fetus is roughly the size of a nectarine. Around this time, the average fetus weighs about 1.5 ounces and can measure up to 3.5 inches long, crown to rump. Making faces. Thanks to brain impulses, your baby's facial muscles are getting a workout. Those tiny features can squint, frown, and grimace. Your baby is also making sucking and chewing movements. Growing hair. Soft baby hair is coming. Hair follicles have started to form deep in your baby's skin. Around 20 weeks, fine downy hair will sprout from these follicles on your baby's eyebrows, upper lip, and chin. Your active baby. Though you can't feel those tiny punches and kicks yet, your baby is quite active and has flexible hands and feet. Mom's body at 14 weeks pregnant. You've finally reached the second trimester. Pregnancy symptoms during week 14. No more morning sickness? Your energy is likely returning, and your queasiness may have eased by now. If not, hang on, chances are good that morning sickness will soon be behind you if it's not already. Although it's uncommon, some expecting moms will still feel nauseated months from now. Tell your healthcare provider at your next appointment if you're still having nausea or vomiting. Starting to show. The top of your uterus is a bit above your pubic bone, which may be enough to push your tummy out a tad. Starting to show can be quite a thrill, giving you and your partner visible evidence of the baby you're waiting for. Bleeding gums. About half of pregnant women have swollen, red, tender gums that bleed when flossed or brushed. This gum inflammation, called pregnancy gingivitis, is partly caused by hormonal changes that make your gums more sensitive to the bacteria in plaque. Be sure to brush your teeth twice daily and floss daily. Round ligament pain. On either side of your uterus, you have 2 ligaments that stretch and thicken to accommodate your growing belly. These changes may cause round ligament pain. It can feel like a short, stabbing pain in response to movement, or a dull ache after an especially active day. If round ligament pain strikes, try to stop and rest, pay attention to your posture, change positions, gently massage the area, or take a warm bath, and that wearing a maternity belt for extra support helps relieve the pain. Increased appetite. Pregnancy hunger starts and peaks in the second trimester. Your body is working hard to support your baby, and that requires plenty of energy. Your meals are also fueling your body's pregnancy changes, which include a much higher blood volume, your growing breasts and uterus, and increased fat stores. You need an extra 300 to 350 calories per day in the second trimester. Round ligament pain. For some women, a possible side effect of uterine growth is what your OB/GYN would call round ligament pain. Basically, these are pregnancy growing pains that feel like achy or sharp pains on one or both sides of the abdomen. That begin to appear around 14 weeks but can strike at any time during the second trimester. Here's why. The uterus is supported by thick bands of ligaments that run from the groin up the side of the abdomen. As your uterus grows, the supporting ligaments stretch and thin out to accommodate the increasing weight. This weight pulls on the ligaments and causes a sharp pain or a dull ache in your lower abdomen. It's often more noticeable when you change positions suddenly or quickly get up from sitting or lying down, or when you cough or sneeze. The best way to bring relief? Put your feet up and rest in a comfortable position, which should ease the strain and the pain. Baby development at 15 weeks. Your baby is about the size of an apple. Your baby is around the size of an apple or a navel orange. It measures around 4 inches, 10 centimeters, from crown to rump. It weighs approximately 70 grams, which is equivalent to 0.15 pounds. Baby weight at 15 weeks is similar to the weight of one chicken egg. Your baby at week 15. Pregnancy week 15, fetal development. Your baby at 15 weeks pregnant has already formed all its vital organs, so now it's time to grow bigger and stronger. Among the milestones of week 15 of pregnancy fetal development is the beginning of bone ossification. The muscles are strengthening, and the bones are becoming harder. By now, the baby has longer limbs and can move its joints. Although it's not common, some women can feel baby movements at 15 weeks pregnant. Your baby is also practicing how to breathe outside your womb. She is actively drawing in amniotic fluid through her nose. It is getting into the upper respiratory tract, developing the lungs. The baby's skin is still very translucent, and small blood vessels are forming under it. Your 15-week fetus is also practicing other reflexes, such as swallowing and sucking. At 15 weeks of pregnancy, your baby is also looking much cuter, since its head is now proportional to the rest of its body. Their skin is getting covered in very fine hair, which is called lanugo and helps keep the baby warm. In the womb, a 15-week baby is also able to hear your voice. Make sure you talk to your baby constantly. How big is my baby at 15 weeks? Curious why your body is, probably, finally starting to look pregnant? It's because at 15 weeks pregnant, your baby is quickly growing bigger each week. He's as long as 4 inches right now and weighs around 2.5 ounces. Baby is looking more like a baby. With each passing week, your fetus is also looking more and more like the baby you're picturing in your dreams. By now, the ears are positioned properly on the sides of the head, they used to be in the neck, and the eyes are moving from the side of the head to the front of the face, where they'll soon meet your loving gaze. Sense of taste. Your baby is forming taste buds, and nerves begin connecting them to the brain. By about 20 weeks, your baby's taste buds will be fully formed. During pregnancy, molecules of what you eat pass through your bloodstream and make it into your amniotic fluid. But your baby, so don't worry that they won't enjoy what you're having for dinner. Baby movement. Your baby's legs are growing longer than their arms now, and they can move all of their joints and limbs. Your active baby is moving constantly, though you can't feel it yet. Your baby's face. Your baby is looking more like a little person, with eyelids, eyebrows, eyelashes, nails, hair, and well-defined fingers and toes. If you could see inside your womb, you'd catch your baby sucking a thumb, yawning, stretching, and making faces. What's happening in my body? Your baby is growing quickly and comes with a lot of packaging, the amniotic sac and fluid, and their own food supply, placenta. You could start getting the odd jabbing pain on the sides of your bump. This is known as round ligament pain. Putting your feet up and resting can help. Your skin could also feel a bit itchy. It might help to use an unperfumed moisturizer, wear loose cotton clothing, and have a cool bath. If the itching gets worse, especially at night, talk to your doctor or midwife. 15 weeks pregnant lifestyle. Make sure you're getting enough calcium. Since your baby's bones are beginning to ossify, calcium is more important than ever. A prenatal supplement should be able to provide the calcium you need, but you can also increase your dietary intake for an extra boost. Monitor your weight gain. Drastic weight gain can be a sign of preeclampsia. Talk to your doctor if you think you're gaining too many pounds. Keep a healthy diet. You've probably made some healthy dietary changes in the previous weeks, and your 15 weeks pregnant diet should stay healthy. This will help you avoid excessive weight gain. Stay safe. Although it's advisable to exercise during your pregnancy, 15 weeks pregnancy precautions include avoiding contact sports or sports that carry a risk of falling, like horse riding. Go to the dentist. It might not be pleasant, but taking care of your teeth can actually lead to a healthier pregnancy. Women who develop gingivitis during pregnancy have a higher risk of complications, including preterm birth. Second trimester pregnancy symptoms at 15 weeks. Your pregnancy symptoms may include swollen and bleeding gums, pains on the side of your belly, caused by your expanding womb, known as round ligament pains, headaches, nosebleeds, feeling bloated, indigestion and heartburn, sore breasts, leg cramps, feeling hot, dizziness, swollen hands and feet, urine infections, vaginal infections, darkened skin on your face or brown patches. This is known as cloasma or the mask of pregnancy. Greasier, spotty skin, thicker and shinier hair. You may also experience symptoms from earlier weeks, such as morning sickness, a heightened sense of smell, mood swings, a white milky pregnancy discharge from your vagina and light spotting. Seek medical advice for any bleeding.
The size of the fetus at 16 weeks pregnant. At 16 weeks, your fetus is now the size of an apple. Your little one could be more than 4.5 inches long, crown to rump, and weigh close to 4 ounces. How big is my baby at 16 weeks? Your baby now weighs in at a whopping 3 to 4 ounces, and is 4 to 5 inches in length. The backbone and tiny muscles in your baby's back are gaining strength, so she can straighten out that head and neck even more. Thanks to those developing facial muscles, your baby is capable of making a few expressive frowns and squints, even at this early stage. Baby's beautiful eyes are finally working too, making small side-to-side movements and perceiving light, although the eyelids are still sealed. Delicate baby skin. Your baby's skin is thin and translucent. It will thicken and develop as your pregnancy progresses, but will continue to be almost transparent for quite some time. And here's the skinny on baby skin. It's practically translucent now, so if you took a peek inside your uterus, you'd be able to see your baby's blood vessels under that thin skin. Scalp patterning. On your baby's scalp, hair follicles are forming a pattern that will remain for life. This patterning sets the stage for how your baby's hair will grow. New hair follicles don't form after birth, so babies are born with all the hair follicles they'll ever have. Heart at work. Your baby's heart is now pumping about 25 quarts of blood each day, and this amount will continue to increase as your little one develops. Baby will soon hear your voice. Listen up, tiny bones in your fetus ears are in place, making it likely that baby will soon be able to hear your voice, or something like it, when you're speaking. Generally, babies fully develop the ability to hear in the womb by 18 weeks of pregnancy. During its 16th week of development, a fetus will be starting to form facial expressions, and its nervous system will be growing. Your body at week 16. Rapid growth. At 16 weeks pregnant, your uterus is growing at about the same pace as your baby's. It's getting to the point where you may not be able to hide your pregnancy anymore, even if you wanted to. Your 16 weeks pregnant belly. At 16 weeks pregnant, you may now be at the stage where your bump clearly has a baby in there. Your pregnancy weight gain. It may be hard to watch yourself gain weight during pregnancy, even when you know there's a wonderful reason for it, but try to embrace your body's new shape and think of every pound you put on as a sign of good health for you and your baby. Nasal congestion. 16 weeks pregnant, your symptoms. At 16 weeks pregnant, here are some of the symptoms you may be experiencing. Skin changes. You might have heard about the pregnancy glow, and now it might be your turn to experience it. Increased blood volume in the blood vessels and pregnancy hormones causing more oil production can make pregnant skin look flushed and dewy. Nosebleeds. At 16 weeks pregnant, nosebleeds can be an issue for some moms-to-be, and might be caused by increased circulation and higher levels of hormones. Lower back pain. This is one of the most common symptoms that can strike when you're pregnant, and it's good to have some strategies to avoid or lessen the discomfort. For example, Take warm baths or showers, stretch regularly to help your hardworking back muscles relax, pay attention to your posture, and wear low-heeled shoes. Dizziness. Round ligament pain. As your amazing uterus grows, the round ligaments that support it are thickening and stretching. Breast changes. Pregnancy headaches.
17 weeks baby development. How big is your baby at 17 weeks pregnant? The baby is around 5.1 inches this stage. This is roughly the size of a potato. The skin is loose and wrinkled and the fetus has a lot of growing to do. By the time of the delivery, he or she will fill out their skin more normally. Around this stage of pregnancy, the fetus starts to look a lot more human. In addition to hair growing on the head, the eyebrows and eyelashes are also developing. The eyelids are shut, but the eyes themselves can move and the mouth can also open and close. The fingernails and toenails are growing, and your bundle of joy has also developed a firm grip. Your baby's been getting bigger and bigger over the last couple of weeks, and this means that he or she has needed a larger placenta. Remember that the placenta is the organ that supplies nutrition to the fetus, removes waste products, and fulfills other important roles. By the end of your pregnancy, the placenta will weigh around 510 grams. Your baby now has doubled in weight in the last 2 weeks. Fat begins to form, helping your baby's heat production and metabolism. The lungs are beginning to exhale amniotic fluid, and the circulatory and urinary systems are working. Your baby's bones. Your baby's skeleton is changing from soft cartilage to bone. Support your baby's bone health, and your own, by eating calcium-rich foods. Getting enough calcium also reduces your risk of hypertension and preeclampsia. The umbilical cord. The umbilical cord, your baby's lifeline to the placenta, is growing stronger and thicker. By the end of pregnancy, it will be approximately 9 inches long and an inch thick. The umbilical cord delivers nutrients to your baby and ferries away waste products. Your baby's skin. Sweat glands are starting to develop. And by next week, the layers of your baby's skin will be fully formed. Your baby when you're 17 weeks pregnant. Your baby is getting bigger all the time and might now weigh more than the placenta. Your baby is about 13 centimeters from head to bottom and about 150 grams. Your baby's external sex organs are completely formed. The kidneys are working, and your baby passes urine every 50 minutes or so. Your baby will also swallow some urine, which is sterile, in the amniotic fluid. This is normal. Loud noises might make your baby startle. Your baby's taste buds are working, and your baby can tell the difference between sweet and bitter. What does my baby look like? Your baby, or fetus, is around 12 centimeters long, from head to bottom, and weighs around 150 grams. That's roughly the size of a pomegranate and the weight of a ball of mozzarella. Your baby can move their eyes, although they'll stay shut for now. React to loud noises, open and close their mouth. Your baby's fingernails are starting to grow and will have their own unique fingerprints. Even identical twins have different fingerprints. Week 17, your second trimester. You might start to feel your baby move now. You will not be able to tell exactly what your baby's up to, but soon you could be feeling every kick, punch, hiccup and somersault. Your baby's movements. Many women spot the first signs of their baby moving between 18 and 24 weeks. Inside your tummy, you might feel bubbling, fluttering, rolling. You might find that your baby moves more after meals, when you listen to loud music, when you rub your tummy and talk to your baby, when you are relaxing. Here are some of the other symptoms you may be experiencing: tiredness and difficulty sleeping, swollen or bleeding gums, pain on the side of your belly, headaches, nosebleeds, bloating or constipation, indigestion. Baby development at 18 weeks pregnancy. At 18 weeks of pregnancy, your baby is developing at an incredible rate. During this stage of pregnancy, the baby's body is becoming more proportional, and the organs are maturing. The baby's bones are solidifying, and the baby is beginning to practice making facial expressions. The baby is now able to move in a more coordinated fashion. The baby is able to stretch, kick, and move its arms and legs. It may even be able to respond to external sounds and pressure, such as music or when you press on your abdomen. The baby's senses are developing at this stage of pregnancy as well. The baby's eyes are beginning to open and can detect light. The ears are also opening and allowing the baby to hear sounds from outside the womb. The baby has also developed taste buds and can now distinguish between sweet and sour flavors. The baby is beginning to produce surfactant, a substance that enables the lungs to expand and contract. This will eventually allow the baby to breathe on its own. The baby's hair, nails, and lanugo, the fine hair that covers the baby's body, are also developing. At 18 weeks, your baby is growing rapidly and developing new skills. Although it may be difficult to imagine, your baby is quickly becoming more and more like a newborn. As your baby continues to grow, you will be able to feel more and more of its movements inside your womb. By the end of this stage of pregnancy, you will be able to feel your baby's kicks, punches, and hiccups. Hello and welcome to our video on 19 weeks of pregnancy symptom and baby development. Congratulations on making it to the halfway point of your pregnancy. This is an exciting time as your baby continues to grow and develop, and you start to feel more and more like a mom-to-be. In this video, we'll cover what's happening with your baby and your body during the 19th week of pregnancy. Let's start with your baby's development. At 19 weeks, your baby is the size of a mango, measuring about 6 inches long and weighing around 8.5 ounces. This week, your baby's skin is getting thicker and more opaque, and you may even be able to see tiny veins underneath. Your baby's ears are also fully formed, and they can now hear your voice and other sounds from outside the womb. Your baby's brain is developing rapidly, and the neurons in their brain are now forming more complex connections. This means that your baby's movements are becoming more coordinated, and they may even start to play with their umbilical cord. Your baby is also starting to develop more defined facial features, including eyebrows and eyelashes. Now, let's talk about the symptoms you may be experiencing at 19 weeks pregnant. By this point, many of the early pregnancy symptoms have subsided, and you may be feeling more like yourself again. However, you may still be experiencing some common symptoms such as Braxton Hicks contractions. You may start to feel mild contractions in your uterus as early as the second trimester. These contractions are completely normal and help to prepare your body for labor. Increased appetite. You may find that you're hungrier than usual, especially as your baby's growth requires more energy. Back pain. As your baby grows and your belly expands, you may start to experience back pain. This is due to the extra weight you're carrying and the changes in your posture. Swollen feet and ankles. You may notice that your feet and ankles are starting to swell, especially if you've been standing or sitting for long periods of time. To reduce swelling, try elevating your feet whenever possible and wearing comfortable shoes. Skin changes. You may notice that your skin is becoming more sensitive or that you're developing new stretch marks. These changes are normal and can be managed with moisturizers or creams. In conclusion, at 19 weeks pregnant, your baby is growing and developing rapidly, and you may be experiencing some common symptoms like back pain, swelling, and skin changes. It's important to continue taking care of yourself by eating a healthy diet, staying active, and getting plenty of rest. Remember to schedule your next prenatal appointment with your healthcare provider and ask any questions or concerns you may have. Thank you for watching, and we'll see you in the next video. Hello and welcome to this video on 20 weeks of pregnancy symptoms and baby development. At 20 weeks, you're halfway through your pregnancy and your baby has reached an exciting milestone. So, let's dive into what to expect during this stage. Firstly, let's talk about the baby's development. At this stage, your baby is about the size of a banana, weighing around 10 ounces and measuring around 6.5 inches in length. They are now fully formed and all their major organs are in place. Your baby's skin is still thin and translucent, but they are beginning to develop a layer of fat to help regulate their body temperature. One of the most exciting developments during this stage is that you can now feel your baby's movements. Your baby is becoming more active and you might feel them kicking or moving around. As your baby grows, their movements will become more defined and frequent. Now, let's move on to the symptoms you might experience at 20 weeks of pregnancy. Firstly, many women experience increased appetite during this stage. 2. You may feel like you're constantly hungry and need to eat more often. This is because your body needs more energy to support your growing baby. Another symptom you may experience is heartburn or indigestion. As your uterus expands, it puts pressure on your stomach, which can cause acid reflux. To reduce this, try eating smaller, more frequent meals and avoid spicy or acidic foods. You may also experience some mild swelling in your feet and ankles. This is because your body is retaining more water during pregnancy. To reduce swelling, try resting with your feet elevated and avoid standing or sitting for long periods of time. One of the most common symptoms of pregnancy at 20 weeks is back pain. As your uterus grows, it puts pressure on your back and can cause discomfort. To reduce back pain, try using a pregnancy pillow to support your body while sleeping and avoid lifting heavy objects. Finally, you may experience some mood swings or heightened emotions during this stage. This is normal as your body is going through many changes, and it's important to take care of your emotional well-being as well as your physical health. In terms of prenatal care, it's important to attend all your scheduled appointments with your healthcare provider. At 20 weeks, you will have an ultrasound to check on your baby's growth and development. This is also when you may find out the sex of your baby if you choose to. In summary, at 20 weeks of pregnancy, your baby is fully formed and developing rapidly. You may experience symptoms such as increased appetite, heartburn, swelling, back pain, and mood swings. It's important to attend all your prenatal appointments and take care of your physical and emotional well-being. Thank you for watching this video on 20 weeks of pregnancy symptoms and baby development. We hope you found it informative and helpful. If you have any questions or concerns, please consult with your healthcare provider.
Hello and welcome to our video about the 21 weeks of pregnancy symptom and baby development. In this video, we'll be discussing the changes that are happening in your baby's development and what you can expect during this stage of your pregnancy. Firstly, let's talk about your baby's development. At 21 weeks, your baby is about the size of a carrot, weighing around 360 grams and measuring around 26.7 centimeters long from head to heel. During this stage of development, your baby's body is growing rapidly, and they are developing more defined features. Their eyelids and eyebrows are forming, and their fingernails and toenails are growing. Your baby's brain is also growing rapidly during this stage of development. They are developing more neural connections, which will continue to develop after birth. Your baby is also starting to develop their senses, such as taste, touch, and hearing. They can now hear sounds from outside the womb, so it's a good idea to start talking and singing to your baby to help them recognize your voice. Now let's talk about the symptoms you may experience during this stage of your pregnancy. Firstly, you may start to notice that your belly is getting bigger. As your baby grows, your uterus will expand to accommodate their growth. This can cause some discomfort and may make it more difficult to find a comfortable sleeping position. You may also start to experience some back pain, as the weight of your growing baby can put pressure on your back muscles. To help alleviate this, you can try doing some prenatal exercises that focus on strengthening your back muscles. You can also try using a pregnancy pillow to support your back while you sleep. Another symptom you may experience is heartburn. As your baby grows, they can push your stomach upwards, causing stomach acid to leak into your esophagus. This can cause a burning sensation in your chest and throat. To help alleviate this, try eating smaller, more frequent meals throughout the day, and avoid spicy or greasy foods. You may also notice that your skin is changing during this stage of your pregnancy. Your skin may become more sensitive, and you may develop stretch marks as your belly expands. To help prevent stretch marks, try using a moisturizing lotion on your belly and other areas of your body that may be prone to stretching. Finally, you may start to feel your baby moving more during this stage of your pregnancy. This is a great sign that your baby is healthy and growing. You may feel kicks, punches, or rolls, which can be a fun and exciting experience. As your baby grows, their movements will become more frequent and stronger. In conclusion, at 21 weeks, your baby is growing rapidly and developing more defined features. You may experience some discomfort, such as back pain and heartburn, as your body adjusts to your growing baby. However, feeling your baby move is a wonderful and exciting experience, and a sign that they are healthy and growing. Thank you for watching our video about the 21 weeks of pregnancy symptom and baby development. Please subscribe to our channel for more helpful videos about pregnancy and parenting.
Hello everyone, welcome back to our pregnancy journey. Today, we're going to talk about week 22 of pregnancy, including the symptoms you might be experiencing, as well as the exciting developments happening with your baby. Symptoms. At week 22, you might be feeling some new and different symptoms compared to the previous weeks. Here are some common symptoms you may experience. Braxton Hicks contractions. These are mild contractions that may start to occur in the second trimester. These contractions help prepare your uterus for labor and delivery. Backaches. As your baby grows, your center of gravity shifts, which can cause strain on your back muscles. Be sure to practice good posture and stretch regularly to help alleviate back pain. Leg cramps. You may experience painful leg cramps due to the additional weight you're carrying. Stretching and gentle exercise can help prevent these cramps. Swollen feet and ankles. Your body is retaining more fluids during pregnancy, which can cause swelling in your feet and ankles. Try to elevate your feet when possible and wear comfortable shoes. Baby development. Now, let's talk about the exciting developments happening with your baby at week 22. Your baby is now about 11 inches long and weighs around 1 pound. They are roughly the size of a papaya. Your baby's taste buds are developing, and they can now taste the amniotic fluid. This is the fluid that surrounds your baby in the womb and provides them with nourishment. Your baby's brain is growing rapidly, and they are developing more advanced neurological connections. This means that they can now respond to sound and light, and they may even start to recognize your voice. Your baby's digestive system is starting to function, and they are practicing swallowing amniotic fluid. This helps them prepare for feeding after birth. Your baby's eyes are now fully formed, and they can blink and move them around. They are also developing more pigment in their eyes, which will determine their eye color. Conclusion. So, there you have it, week 22 of pregnancy. Pregnancy progresses. Take care of yourself and your growing baby. Attend your prenatal appointments, eat a healthy and balanced diet, and stay active with exercise that is safe for pregnancy. And most importantly, enjoy this special time in your life as you prepare to welcome your little one into the world. Thank you for watching, and we'll see you next time. Hello and welcome back to our pregnancy series. In this video, we will be discussing the 23 week of pregnancy, including the symptoms you may experience and the development of your growing baby. Symptoms. At 23 weeks pregnant, you may start to experience some new symptoms. One common symptom is increased fatigue. Your body is working hard to support your growing baby, which can leave you feeling more tired than usual. It's important to listen to your body and get plenty of rest during this time. You may also experience some discomfort as your uterus continues to expand. This can lead to back pain, pelvic pain, and even leg cramps. Gentle stretches and prenatal yoga can help alleviate these symptoms. Some women may also notice an increase in vaginal discharge at this stage of pregnancy. As long as it's not accompanied by itching or a foul odor, this is typically normal. Baby development. Now, let's talk about your baby's development at 23 weeks. Your baby is now about the size of a large mango, measuring around 11 inches from head to toe and weighing around 1.1 pounds. Your baby's hearing is developing rapidly at this stage, and they can now hear sounds from outside the womb. This means that your baby can hear your voice, so it's a great time to start talking or singing to your growing little one. Your baby's skin is also starting to thicken and become more opaque, although they still have a long way to go before they develop the protective layer of fat that will keep them warm after birth. Your baby's lungs are continuing to mature, and they may start practicing breathing movements by inhaling and exhaling small amounts of amniotic fluid. Finally, your baby's sense of movement and position in the womb is improving, to feel more distinct kicks, punches, and even somersaults as your baby becomes more active. Conclusion: so there you have it, the 23rd week of pregnancy. Remember to take care of yourself and listen to your body's needs, and don't forget to talk to your baby and enjoy the special bond that's forming between you. We hope you found this video informative and helpful. Please subscribe to our channel for more pregnancy updates, and we'll see you in the next one.
Hello and welcome to this week's pregnancy update. If you're 24 weeks pregnant, congratulations, you've made it to the 6-month mark. Let's take a look at what you and your baby can expect during this exciting time. Symptoms: as you near the end of your second trimester, you may start to experience some new or intensified symptoms. Here are a few common ones. Braxton Hicks contractions. You may start to feel mild, painless contractions that come and go. These are a normal part of pregnancy and help prepare your body for labor. Shortness of breath. Your growing baby is taking up more space in your uterus, which can put pressure on your lungs and make it harder to breathe. Heartburn. The hormones in your body that relax your muscles to prepare for childbirth can also relax the valve that separates your esophagus from your stomach, leading to heartburn. Trouble sleeping. As your belly grows, it can be harder to get comfortable at night. You may also be experiencing vivid dreams or nightmares. Baby development. Your baby is growing and developing rapidly during week 24 of pregnancy. Here are some of the exciting things happening. Size. Your baby is now about the size of an ear of corn, measuring around 11.8 inches long and weighing about 1.3 pounds. Brain development. Your baby's brain is growing quickly and developing more complex neural connections. Lung development. Your baby's lungs are producing surfactant, a substance that helps the lungs expand and contract properly. Sensory development. Your baby's senses are becoming more refined, and they can now hear your voice and other sounds outside the womb. Movement. Your baby is becoming more active and may be able to kick, twist, and turn in the womb. Tips for the week. Stay hydrated. Drinking plenty of water can help reduce swelling and keep you feeling energized. Sleep on your left side. Sleeping on your left side can improve blood flow to the placenta and help your baby get the nutrients they need. Take breaks. If you're feeling tired or overwhelmed, don't hesitate to take a break and rest. Practice relaxation techniques. Relaxation techniques like deep breathing, meditation, or prenatal yoga can help reduce stress and promote relaxation. Start thinking about childbirth classes. Many hospitals and birthing centers offer childbirth classes that can help prepare you for labor and delivery. That's all for this week's update. If you have any questions or concerns, be sure to talk to your healthcare provider. We'll see you next week for another exciting update on your pregnancy journey. Hello and welcome to this week's pregnancy update. Today, we'll be talking about week 25 of your pregnancy, including the symptoms you may be experiencing and how your baby is developing. First, let's talk about your baby's development. At 25 weeks, your baby is now the size of a rutabaga, measuring around 13.6 inches long and weighing around 1.5 pounds. Your baby's skin is becoming more opaque and less transparent, and the blood vessels are now visible through their skin. Your baby's lungs are also continuing to develop, with air sacs starting to form. This is an important step towards being able to breathe on their own after birth. Your baby is also starting to develop their sense of touch, as the nerve endings in their skin become more sensitive. Now, let's move on to the symptoms you may be experiencing at 25 weeks. Many women find that they have more energy during this time, as their body has adjusted to the changes of pregnancy. However, you may still be experiencing some of the following symptoms. Braxton Hicks contractions. You may start to experience these practice contractions, which are your body's way of preparing for labor. Back pain. As your baby grows, your center of gravity shifts, which can cause back pain. Shortness of breath. As your uterus expands, it can put pressure on your diaphragm, making it harder to breathe. Heartburn. As your baby grows, they can put pressure on your stomach, causing acid reflux. Swelling. Your body may start to retain more water, which can cause swelling in your feet and ankles. Varicose veins. The increased pressure on your blood vessels can cause varicose veins to develop in your legs. Trouble sleeping. As your baby becomes more active, you may find it harder to get comfortable and fall asleep. It's important to remember that every woman's pregnancy is different, and you may experience some, all, or none of these symptoms. If you're concerned about any symptoms you're experiencing, be sure to talk to your healthcare provider. That's all for this week's pregnancy update. Join us next time for week 26, as we continue to track your baby's development and your pregnancy journey. Thanks for watching.
Welcome to The Incredible Journey, a comprehensive guide to 26-week pregnancy and baby development. Pregnancy is an incredible journey filled with joy, excitement, and sometimes, uncertainty. At 26 weeks pregnant, your baby is about the size of a butternut squash and is rapidly developing. In this video, we'll explore what's happening during the 26th week of pregnancy and take a closer look at your baby's physical and cognitive development. So, sit back, relax, and let's dive in. The 26th week of pregnancy is an exciting time as your baby continues to grow and develop rapidly. This week, your baby is about 14 inches long and weighs around 1.5 pounds. Your baby's senses are developing, and they are becoming more active. In this video, we will explore what's happening during the 26th week of pregnancy and take a closer look at your baby's physical and cognitive development. At 26 weeks pregnant, your baby is rapidly developing, and their senses are starting to come alive. Your baby's brain is developing rapidly, and they are becoming more aware of their surroundings. They can now hear your voice and respond to sounds, and their eyes are starting to open. Your baby is also starting to develop more fat, which will help regulate their body temperature after birth. Your body is also going through many changes during the 26th week of pregnancy. Your uterus is now about 2.5 inches above your belly button, and you may be starting to experience more Braxton Hicks contractions. These are mild, irregular contractions that prepare your body for labor. As your baby grows and your uterus expands, you may experience more aches and pains. Backaches, leg cramps, and hip pain are common at this stage of pregnancy. It's important to rest and take care of yourself during this time. That's it for this video on the 26th week of pregnancy and baby development. We hope you found this information valuable and informative. Remember, every pregnancy is different, so be sure to talk to your doctor if you have any concerns or questions. Join us next time on The Incredible Journey as we continue to explore the miracle of pregnancy and baby development.
Natural remedies for pregnancy morning sickness. 20 effective tips. 1. Introduction. Welcome to our channel. Today we'll explore 20 natural remedies to help alleviate morning sickness during pregnancy. 2. Stay hydrated. Start your day with a glass of water to stay hydrated and combat nausea. 3. Ginger tea. Sip on ginger tea throughout the day. It's known for its anti-nausea properties. 4. Small, frequent meals. Opt for smaller, more frequent meals to prevent an empty stomach triggering nausea. 5. Crackers or dry toast. Keep crackers or dry toast by your bedside and munch on them before getting out of bed. 6. Vitamin B6 supplements. Consider taking vitamin B6 supplements under medical guidance to ease morning sickness. 7. Peppermint aromatherapy. Inhale oil or use peppermint aromatherapy to soothe nausea. 8. Acupressure wristbands. Talks. Try acupressure wristbands, which target specific pressure points to alleviate morning sickness. 9. Lemon water. Squeeze fresh lemon into your water. The scent and taste may help calm your stomach. 10. Avoid strong odors. Steer clear of strong odors, as heightened senses during pregnancy can trigger nausea. 11. Protein-rich snacks. Snack on protein-rich foods like nuts or yogurt to stabilize blood sugar levels. 12. Chamomile tea. Enjoy a cup of chamomile tea. Its calming properties can ease nausea and promote relaxation. 13. Minty foods. Include minty foods like peppermint candies or gum to help soothe your stomach. 14. Lavender oil. Diffuse lavender oil or add a few drops to a cotton ball for a calming effect. 15. Cold compress. Apply a cold compress to your forehead or neck to alleviate nausea symptoms. 16. Stay active. Engage in light exercises like walking to promote overall well-being and reduce nausea. 17. Papaya enzymes. Consider papaya enzyme supplements to aid digestion and minimize nausea. 18. Yoga and deep breathing. Practice gentle yoga and deep breathing exercises to relax your body and mind. 19. Keep a food diary. Monitor your diet and identify triggers by keeping a food diary. 20. Consult your healthcare provider. Always consult your healthcare provider before trying new remedies to ensure they're safe for you and your baby. Remember, every pregnancy is unique, and what works for one person may not work for another. If symptoms persist, seek professional advice. Don't forget to like, share, and subscribe for more helpful content.
Pregnancy week 1 to 2. 1 and 2 weeks pregnant. Congratulations! During the first and second week of pregnancy, your body is preparing for possible conception. How is pregnancy calculated? Calculating the day your baby begins to develop and keeping track of your pregnancy dates can be a challenge. The development of pregnancy is counted from the first day of the woman's last normal menstrual period, LMP, even though the development of the fetus does not begin until conception, which is about 2 weeks later. Pregnancy is calculated from this day because each time a woman has a period, her body is preparing for pregnancy. Counting from the LMP, most women are pregnant an average of 280 days. Calculating from the LMP also gives a standard of measurement for healthcare providers to follow, since it is extremely difficult to know exactly when conception occurred. For more information on how pregnancy is measured, please see our information on calculating your dates.
What changes are occurring with your body? Your period has just begun, and you may be thinking about becoming pregnant. Your ovulation time is the most important thing you need to understand when trying to conceive. Ovulation occurs when a mature egg is released from the ovary, pushed down the fallopian tube, and available to be fertilized. The lining of the uterus has thickened to prepare for a fertilized egg. If conception does not occur, the uterine lining will be shed. The shedding of an unfertilized egg and the uterine wall occurs during menstruation. There are also several facts that you need to know concerning ovulation. An egg lives 12 to 24 hours after leaving the ovary. Normally, only one egg is released each time you ovulate. Ovulation can be affected by stress, illness, travel, and significant changes in weight, exercise, and sleeping patterns. Some women may experience light spotting during ovulation. This is not considered to be an actual period, but rather an ovulatory bleeding. What is happening with your baby? Nothing is happening yet, but be patient while the stage is being set. Before long, an egg will be released and will be available to be fertilized. How do you track ovulation? A woman's monthly cycle is measured from the first day of her menstrual period until the first day of her next period. On average, a woman's cycle normally is between 28 to 32 days. Ovulation is calculated by starting with the first day of the cycle, which is the day the menstrual period begins. Most women ovulate on any one day between day 11, day 21 of their cycle. This is what many refer to as the fertile time or fertility window of a woman's cycle because sexual intercourse during this time increases the chance of pregnancy. For more information on tracking ovulation, please see Fertility Awareness, Understanding Ovulation, Ovulation Calendar. What should you plan at this time? There may need to be some lifestyle changes made at this time to increase your chances of conceiving and having a healthy baby down the road. Adequate exercise and a balanced diet are important factors to evaluate. It is recommended to begin taking prenatal vitamins and stop using substances such as caffeine, artificial sweeteners, alcohol, recreational drugs, nicotine. If you are taking prescription drugs, check with your healthcare provider to see if such medication is safe to take during pregnancy. For more information on nutrition during pregnancy, please see our information on preconception nutrition. Tips for making your pregnancy better. The most important thing you can do right now is to act in the way you would if you already knew you were pregnant. Since it can be weeks before you know if conception has occurred, this will protect both you and your future baby from any substances or activities that could cause problems.
3 weeks pregnant. Sperm met egg last week, and voila, you've made a baby. It's so early that when you're 3 weeks pregnant, you may have no idea that you're actually pregnant. Conception just happened a few days ago, and there probably hasn't been time for you to miss a period yet at week 3 of pregnancy. Can you tell you're pregnant at 3 weeks? While some people feel no difference at all at this early stage, others may start to notice 3 weeks pregnant symptoms. The experience at 3 weeks pregnant can really vary, so don't fret if you don't feel anything out of the ordinary. However, if you feel nauseous and your breasts are sore, that's normal too. Everything changes quickly in early pregnancy, so no matter how you feel, be prepared to feel different in a week. 3 weeks pregnant symptoms. When you're 3 weeks pregnant, symptoms may not have appeared yet. That's because most early pregnancy symptoms are caused by pregnancy hormones. Spotting as the fertilized egg burrows into the lining of your uterus. Nausea. As the pregnancy hormone HCG begins to make its way through your newly pregnant body, you may notice some feelings of queasiness, or nausea so bad it makes you puke. Morning sickness should really be called all-day sickness since it doesn't discriminate by time of day. If you're feeling this symptom of pregnancy at 3 weeks, you may be further along than you thought, or you may even be 3 weeks pregnant with twins. That's because twin moms-to-be often have higher levels of pregnancy hormones and therefore worse nausea. Breast changes. Your breasts can start to get sore and your nipples may darken as your body starts prepping to make milk. Missed period. If your cycle is typically shorter than 28 days, you may realize toward the end of this week that you could be pregnant. The only way to know for sure is to take a pregnancy test. Positive home pregnancy test. Check the box of your home pregnancy test to see how accurate its results are before your missed period. Most are over 99% accurate once you've missed it, and some brands promise to detect pregnancy hormones in your urine sooner than that. For example, when you're 3 weeks 5 days pregnant or even 3 weeks 4 days pregnant. Here's the thing, the amount of pregnancy hormone HCG in your body might not be enough for the test to detect right away, but it doubles every 48 hours. If you get a negative result, follow up a few days and then a week later with another pregnancy test and then another, to be sure it wasn't just too early to tell. Positive blood pregnancy test. In some cases, like if you're at risk for miscarriage or ectopic pregnancy, your doctor may ask you to come into the office for a blood draw. Blood tests can detect smaller amounts of HCG than urine tests can, so you may find out that you're pregnant. 3 weeks, pregnant belly. A belly isn't really a thing. Though you may feel a bit bloated, most pregnant women don't start to show until around week 12 or later. Before you start eating for 2, know that doctors only recommend most women gain 1 to 5 pounds total in the first trimester, that's the first 13 weeks. So you definitely don't have license to start indulging at 3 weeks pregnant. In fact, try to eat a healthy, well-rounded diet and to take a daily prenatal vitamin with at least 400 micrograms of folic acid in it. Doctors don't recommend increasing your daily calorie intake until the second trimester. Once you hit week 14, you'll want to add about 300 calories per day.
During week 4, the tiny life you and your partner created just a week ago is implanting and settling into its new home in your uterus, where it will grow and develop over the next 36 weeks. Along with implantation, comes a rise in the pregnancy hormone HCG. At the end of this week, there may be enough HCG to detect with a sensitive early home pregnancy test. First, what is your baby's due date? Your baby's development at 4 weeks. Starting at week 4, your baby is called an embryo. At just 0.2 millimeters, your little embryo is about the size of a poppy seed. Implantation. When the fertilized egg is in the uterus and attaches to the uterine wall, it is called implantation. Implantation usually takes place 6 to 10 days after ovulation. So, if it didn't happen at the end of week 3, your budding baby will burrow into your uterine lining this week. Early development. There inside your fertilized egg are all the cells that will develop into your baby and what your baby needs to survive for the next 9 months. The inner cells begin to transform into your baby's organs and body parts. The outer cells start to form the placenta. You and your baby at 4 weeks pregnant. Your baby at 4 weeks. In weeks 4 to 5 of early pregnancy, the embryo grows and develops within the lining of your womb. The outer cells reach out to form links with your blood supply. The inner cells form into 2, and then later into 3 layers. Each of these layers will grow to be different parts of your baby's body. The inner layer becomes the breathing and digestive systems, including the lungs, stomach, gut, and bladder. The middle layer becomes the heart, blood vessels, muscles, and bones. The outer layer becomes the brain and nervous system, the eye lenses, tooth enamel, skin, and nails. In these early weeks of pregnancy, the embryo is attached to a tiny yolk sac that provides nourishment. A few weeks later, the placenta will be fully formed and take over the transfer of nutrients to the embryo. The embryo is surrounded by fluid inside the amniotic sac. It's the outer layer of this sac that develops into the placenta. Cells from the placenta grow deep into the wall of the womb, establishing a rich blood supply. This ensures the baby receives all the oxygen and nutrients it needs. You at 4 weeks. Conception usually takes place about 2 weeks after your last period, around the time you release an egg, ovulate. In the first 4 weeks of pregnancy, you probably will not notice any symptoms. The first thing you may notice is that your period does not arrive, or you may have other signs and symptoms of pregnancy, such as breast tenderness. You can confirm the pregnancy with a pregnancy test.
5 weeks pregnant symptoms. Pregnancy symptoms are unique and unpredictable. 2 people can each have healthy pregnancies without any of the same symptoms. Likewise, you may have bad nausea in your first pregnancy, but no morning sickness in a later pregnancy. The swiftly rising levels of the hormones human chorionic gonadotropin, HCG, and progesterone are responsible for many of the pregnancy symptoms you experience. You can expect any of the following week 5 pregnancy symptoms. 1. Morning sickness. Don't be fooled by the word morning. Nausea and vomiting can happen at any time during the day. While morning sickness typically begins during week 6 of pregnancy, some people experience it earlier. Eating several small meals throughout the day, instead of 2 or 3 big meals, may help to relieve these symptoms. Call your doctor if you can't keep any food or liquid down. This may be a sign of hyperemesis gravidarum, which is a rare disorder that involves continual nausea and vomiting during pregnancy. It sometimes requires inpatient treatment at a hospital. 2. Lightheadedness. Your blood pressure tends to run lower than usual during pregnancy. This can cause dizziness and even fainting. If you feel dizzy, sit down if you're standing or pull over if you're driving. 3. Frequent urination. As your uterus expands, it can press against your bladder. This will likely cause you to need to urinate more frequently. Go when you have the urge so that you avoid bladder infections. Drink plenty of water to avoid becoming dehydrated. 4. Abdominal cramps. You may experience mild cramping or bloating. This can be caused by the egg implanting or from your uterus stretching. While mild cramping shouldn't cause alarm, contact your doctor immediately if you experience severe pain that doesn't go away. 5. Vaginal bleeding. Light bleeding, also known as spotting, around the time of your missed period is usually considered implantation bleeding. While spotting can be caused by many factors, always let your doctor know if you notice any spotting or bleeding at any time during pregnancy. 6. Fatigue. As your progesterone levels increase, you may find yourself feeling sleepy and losing energy. Fatigue is most common during the first trimester, but some people will experience fatigue throughout their pregnancy. 7. Breast changes. You may experience tender, sore, swollen, or fuller breasts as your hormone levels change. This is one of the earliest symptoms of pregnancy and may appear soon after conception. 8. Food cravings and aversions. Your changing hormones can lead to a change in your appetite. You may find yourself avoiding foods you used to enjoy, or you may start craving foods you don't commonly eat. You can begin experiencing food cravings and aversions early on in your pregnancy. 9. Constipation. Your food will start moving more slowly through your digestive system to give nutrients more time to be absorbed into your bloodstream and reach your baby. This delayed transit can lead to constipation. Eating more fiber and drinking lots of fluids can help relieve or eliminate constipation. 10. Increased vaginal discharge. Vaginal discharge during pregnancy may be expected. It should be thin, white, milky, and mild smelling. If the discharge is green or yellowish, has a strong smell, or is accompanied by redness or itching, you should contact your doctor. This is likely a sign of a vaginal infection. 11. Mood swings. Pregnancy can cause a lot of emotions. Not only can the idea of a new baby cause emotional stress, but the changes in your hormones can also affect your emotions. It's perfectly fine to feel a variety of emotions from day to day, such as elation, sadness, anxiety, fear, and exhaustion. If these feelings are extreme or last more than a few days, consult your doctor right away. Warning signs of a miscarriage. According to the American College of Obstetricians and Gynecologists, about 10% of pregnancies end in miscarriage. Signs of a miscarriage include vaginal bleeding, the most common sign, which tends to be heavier than spotting and may contain clots. Abdominal or pelvic cramps. Back pain. Call your doctor if you experience any bleeding during pregnancy. An ectopic or a tubulate pregnancy is a pregnancy that grows outside the uterus, most often in the fallopian tube. This type of pregnancy isn't viable and can be life-threatening to the birthing parent. Symptoms of an ectopic pregnancy include vaginal bleeding, pelvic pain or cramping, possibly on one side, shoulder pain, dizziness or fainting. Call your doctor right away if you feel as though you are having symptoms of an ectopic pregnancy. Your baby development. The 5th week of pregnancy marks the start of the embryonic period. This is when baby's body systems and structures begin to form, such as the heart, brain, and spinal cord. Your baby's heart beats at a steady rate now, though it may not be detected by ultrasound for another 1 or 2 weeks. The placenta is also starting to develop. At this stage, your baby doesn't look like a baby yet. The embryo is growing quickly, but it's still very small, about the size of a pen tip or a sesame seed. Around this time, baby initially measures just 2 to 3 millimeters. Your body is gearing up to go through big changes, too. Pregnancy hormone levels are rapidly rising, and your uterus will begin to grow. You won't look pregnant for a couple more months, but you may start to experience symptoms now. Twin development at week 5. If you're carrying multiples, you may be able to detect your babies through an early ultrasound during week 5. Your babies are measured in millimeters at this point, but you might see 2 gestational sacs or even a couple of tiny fetal poles as the week goes on. Occasionally, you'll detect 2 gestational sacs at this early stage, but only 1 baby at a later ultrasound. This is called vanishing twin syndrome. There's often no clear reason for the loss, per 2021 research. You may have cramping and bleeding, or you may have no symptoms at all.
6 weeks pregnant, your little one is developing new features. This week's most important milestone, the neural tube begins to close over what will become your baby's spinal cord. There's more. This week, the areas that will become the eyes and ears have started to project as bumps, and other tiny buds are forming that will eventually grow into arms and legs. A tiny heartbeat of about 105 beats per minute may be detectable in an ultrasound this week, and the brain and nervous system are also developing quickly. In fact, the nose, mouth, and inner and outer ears are just starting to take shape, along with the lungs. In just a few weeks, breathing tubes will form between the throat and the lungs, getting ready for your little one's first breath of air, and maybe a loud wail, at birth. The size of the embryo at 6 weeks pregnant. At 6 weeks, your embryo measures an average of 0.08 to 0.2 inches, about the size of a pomegranate seed. Take a look at the visual below to get an idea of how things are progressing inside your belly. At 6 weeks, when it comes to the embryo, things are starting to take shape. Mom's body at 6 weeks pregnant. This week, your breasts may feel tender or achy because of increased blood flow. This is a normal part of your body preparing for breastfeeding. Wearing a supportive bra can help with discomfort. You may also experience constipation because of an increase in progesterone, which slows down the digestive tract. To deal with this, exercise regularly, eat a balanced diet with high-fiber foods, and drink plenty of water. 6 weeks pregnant, your symptoms. At 6 weeks pregnant, here are some of the symptoms you may be experiencing. Spotting. It's not unusual to see some spotting at 6 weeks, but it should be light, not even enough to cover a small pantyliner. This implantation bleeding is normal, but if you see a lot of blood, if the spotting lasts longer than 2 days, or you have any concerns, be sure to see your doctor right away. Cramping. At 6 weeks pregnant, slight cramping can be normal. It's a sign your uterus and the surrounding tissues are expanding to make room for your baby. If you feel pain more severe than usual period cramping, especially if accompanied by a fever or diarrhea, contact your doctor immediately. Morning sickness. If you haven't yet had morning sickness, this may be the week it arrives. Morning sickness can happen any time of day or night. It may be triggered by certain movements, smells, an empty stomach, or nothing at all. Crackers and other simple, starchy foods can help, so keep a little something on hand for those random bouts of nausea. Exhaustion. You may feel completely exhausted due to pregnancy fatigue, and that's okay. As your levels of the pregnancy hormone progesterone are increasing, making you more and more tired, you may find taking naps can help. Some women also say that little snacks and some light exercise are effective in fighting off fatigue. Ways to help yourself feel a bit better. No symptoms. That's right, it's possible to be 6 weeks pregnant with no symptoms whatsoever. Every pregnancy and every woman is different. For example, some women never experience morning sickness, so if you're one of the lucky few, enjoy these nausea-free days without worry. 7 weeks pregnant, your baby's development. Although your baby's brain development will continue long after birth, the basic sections have formed. As the week progresses, the digestive system and lungs are also developing. Tiny facial features are also starting to take shape, and each little arm now has a paddle-shaped hand attached to it. Another important development this week is the formation of the umbilical cord. This cord creates a connection between you and your developing baby throughout your pregnancy that allows nutrients and oxygen to flow between you and also eliminates your baby's waste. If you have a prenatal checkup scheduled for this week or sometime soon, and have an ultrasound exam, you may have an opportunity to see and hear something amazing, a heartbeat. Don't worry if this isn't in your healthcare provider's plans quite yet. The size of the embryo at 7 weeks pregnant. Your little one is growing fast. At 7 weeks, the embryo is about the size of a small blueberry, about 0.3 inch long. For a visual idea of how things are developing inside your uterus this week, check out this illustration: placenta, yolk sac, embryo, amniotic sac, uterus, cervix. Mom's body at 7 weeks pregnant. The pregnancy signs and symptoms you may have experienced in the past weeks will probably continue, and some of them may become more pronounced this week. Although these symptoms can be tiring and annoying, keep in mind that you're just a few weeks away from your second trimester, when many of these symptoms may subside. One symptom you may be experiencing around this week of pregnancy is frequent urination. Hormonal changes and increased blood volume are to blame for this. Now that there's more fluid in your system, it means more for your kidneys to process, and as a result, more urine is produced. 7 weeks pregnant, your symptoms. At 7 weeks pregnant, here are some of the symptoms you may be experiencing. Excess salivation. You may notice more saliva than usual, often accompanying the nausea and vomiting of morning sickness. It may feel weird, but this is just another strange, yet normal part of pregnancy for many women. Food cravings or aversions. Feel like pickles and chocolate for dinner? Can't stand the smell of eggs even though it never used to bother you? Your food preferences and tolerance for odors may change during this time, and these changes are most likely caused by hormones. If you find yourself craving any non-food items, like dirt or chalk, talk to your healthcare provider right away. Nausea. Of all of this week's symptoms, morning sickness can be the worst. It's often in full effect at this stage, and it can make you feel absolutely miserable. Luckily, for many women it's likely to disappear during the second trimester. Diarrhea. As if you needed another trip to the bathroom at 7 weeks, diarrhea is usually nothing to worry about. It may be one of the gastrointestinal symptoms, like constipation or indigestion, that you might experience due to fluctuating hormones. Try adding foods like applesauce, oatmeal, and bananas to your diet to help absorb any excess water, and stay hydrated, as diarrhea can lead to dehydration. Spotting. Light spotting at 7 weeks pregnant is considered normal, especially after sex. If you notice heavier bleeding, call your healthcare provider. Cramping. If you feel mild cramps, what you're experiencing is quite normal. Your uterus is expanding, so some discomfort is to be expected. If the cramping is severe or long-lasting, or if you feel pain other than cramping, call your healthcare provider. Fatigue. You may continue to feel exhausted this week. Your levels of the hormone progesterone are quickly increasing, and it's this hormone that can make you feel sleepy.
8 weeks pregnant, your baby's development. This week, hands and feet are forming tiny fingers and toes, and those arms are able to flex at the elbows and wrists. At this point, eyes begin to develop pigment, and genitals are forming too, although it's still too soon to know whether you're expecting a boy or a girl. If you feel like taking a guess though, have some fun with our baby gender quiz. These external features aren't the only things developing, the internal organs are making strides. As the intestines form, they start to take up space in the umbilical cord because there's not enough room in your baby's abdomen yet. Even at this early stage, the intestines are working to carry waste away from the body. A month from now, when there's more room in your little one's belly, the intestines will move out of the cord and back into the abdomen. The size of the embryo at 8 weeks pregnant. Your baby has already come a long way, and soon, growth will speed right up. Your little one is about the size just 0.5 to 0.6 inch long, crown to rump. Mom's body at 8 weeks pregnant. By the time you're 8 weeks pregnant, pregnancy symptoms will be in full swing. Your clothes may start to pinch a little, but on the plus side, you may be able to hear your baby's heartbeat for the first time, something to make up for the not-so-pleasant symptoms you may have been experiencing. You may be wondering when you will start showing. 8 weeks pregnant, your symptoms. At 8 weeks pregnant, here are some of the symptoms you may be experiencing. Morning sickness. You may be dealing with nausea and even vomiting right about now. The good news is morning sickness symptoms usually subside during the second trimester, and you're almost there. For now, try nibbling on crackers before you get up, and aim for 5 or 6 small meals a day, rather than 3 large ones. Food and smell aversions. Certain tastes and odors that have never bothered you before may seem overbearing or repugnant, thanks to increased hormones that amplify your sense of smell and make your stomach feel as if you're on a wild roller coaster ride. Diarrhea. Your digestive system may be far more sensitive now. Make sure you're practicing healthy eating habits and staying hydrated. Contact your healthcare provider if the diarrhea lasts longer than 24 hours or is accompanied by any other symptoms, and do not take anti-diarrheal medicine or any medication before checking with your provider. Frequent urination. Yes, you may still be making lots of extra trips to the bathroom. This symptom will come and go throughout the rest of your pregnancy as your baby grows and your uterus expands, both of which put pressure on your bladder. Abdominal cramping. This symptom can be associated with the continued growth of your uterus. Back pain. By the time you are 8 weeks pregnant, back pain may strike, particularly around the lower back. That's because the muscles in your back are working a bit harder than usual as your weight is redistributed to accommodate your growing uterus. Furthermore, your center of gravity is changing, and those pregnancy hormones are working on relaxing ligaments in the joints of your pelvis. Light spotting. Spotting, a few drops of blood at a time, can be normal. However, be sure to talk to your healthcare provider if you feel at all concerned and call right away if you notice heavier bleeding. Fatigue. Your progesterone levels are increasing, which can often leave you feeling more tired than usual. Go ahead and grab some extra snooze time whenever you can. If you're feeling exhausted, listen to your body and try to take it easy. Trouble sleeping. Changing hormone levels, discomfort, and extra trips to the restroom often add up to disturbed sleep. Try listening to peaceful music or reading a book if you're feeling wide awake. You can also try drinking warm milk or taking a shower or bath before bed. Some women find lying on their left side is helpful as it improves blood circulation. Placing a pillow between your knees may help you feel more comfortable too. 9 weeks pregnant. Your baby's development. This week, your little one, now officially known as a fetus, is looking less and less like a little pink blob and instead has more of a mini baby shape. Even the tail that had been present in earlier weeks has almost disappeared. Tiny facial features continue to develop this week, including a more prominent nose and eyelids. Up top, the head is large compared to the body, while down below, little toes are now visible. Internal organs are also forming, including the digestive and reproductive systems, meaning that the intestines as well as testes or ovaries are growing. Now that you're 9 weeks pregnant, your little one may be starting to move, thanks to some recent muscle development. But you'll have to wait until sometime in the second trimester to actually feel these movements. The size of the fetus at 9 weeks pregnant. At 9 weeks, the fetus is about the size of a cherry. Your little one may now measure 0.6 to 0.7 inch long and weigh about 0.12 ounce. Mom's body at 9 weeks pregnant. Symptoms at 9 weeks pregnant may include changes to your breasts. They are probably fuller, heavier, and tender to the touch due to the enlargement of your milk glands and an increase in fatty tissue. Although your breasts will likely continue to grow throughout your pregnancy, the sensitivity will usually subside once your body adjusts to the surge of pregnancy hormones. Spotting. You may see some spotting in the first trimester. Call your healthcare provider if you see any more than a few drops of blood. Mild uterine cramping. This is a time of rapid change in your body, and you may experience mild uterine cramping. If the cramping is severe, or if you feel other pain like lower back pain, call your doctor to rule out any problems. Morning sickness. If you haven't experienced morning sickness by now, you could be one of the lucky ones who will avoid this common symptom. But if you do get morning sickness, keep on eating smaller meals frequently throughout the day and remember to stay hydrated. Being hungrier. You may start to feel a bit hungrier than usual, so munch on some extra snacks, keeping in mind that you only need to add about 300 calories to your daily intake. Foods like fruit, cereal, and yogurt are great choices. Food cravings and aversions. Your sense of smell is heightened now, and foods and smells you once enjoyed may now seem unpleasant. On the flip side, you may now find you crave certain foods. You can feel free to indulge any food cravings you have, as long as they seem healthy. Just make sure you're sticking to a balanced diet. Always talk to your healthcare provider if you crave non-food things like dirt or chalk. Fatigue. Thanks to an increase in your levels of the hormone progesterone during the first trimester, you may find yourself sleepier than usual. Rest as much as you can during the day, particularly if you're having trouble sleeping at night. Feeling moody. If you're feeling on top of the world one minute and doomed the next, you can thank pregnancy hormonal changes. Speak to loved ones about how you're feeling. It may help you feel a little better, and seek help from your healthcare provider if your mood swings are severe. Frequent urination. Yes, those extra trips to the bathroom may still be a part of your day as your baby grows and your uterus presses against your bladder. This need to pee more often may also be caused by the increased volume of blood in your body, which makes your kidneys work overtime. Don't drink less water, as staying hydrated is important, but try to go to the restroom before you head out the door or before you go into a long meeting. If you notice a burning sensation or pain when you pass urine, call your doctor, because this can be a sign of a urinary tract infection. Acne. If you're experiencing acne now and didn't before you got pregnant, or if your acne is worse now than before, it may be one of your pregnancy symptoms. Read up on how you can combat some of those spots and blemishes, and remember that it's just one of those pesky pregnancy hormone-related symptoms that should clear soon after your baby is born. "10 weeks pregnant. Your baby's development. Your baby has come a long way in just a few short weeks. That little head is taking on a rounder, more human shape, and by now all the internal organs should be in place and starting to work together. Tiny tooth buds have begun to develop too. Your baby's fingers and toes are growing longer, and the webs that had been between each finger and toe are starting to disappear. At the moment, your baby's eyes, eyelids, and ears are continuing to develop, but they've still got some growing to do before they're fully formed. The size of the fetus at 10 weeks pregnant. Your little one is still growing very quickly. At 10 weeks, the average fetus is about the size of a strawberry, measuring approximately an inch from crown to rump. Mom's body at 10 weeks pregnant. Your uterus is about the size of a large orange at this point, whereas before you became pregnant, it was about the size of a small pear. Around this time, you likely have had or will soon have a visit with your healthcare provider for a thorough examination. At this appointment, your provider may do an internal and external abdominal exam to determine the size and position of your baby, as well as take blood samples for a variety of other tests. These blood tests may be used to determine if you have any infections, what your blood type and Rh factor are, and whether your own immunizations are up to date. 10 weeks pregnant, your symptoms. At 10 weeks pregnant, experiencing morning sickness. You're not alone if you're 10 weeks pregnant and you're still suffering from morning sickness. The good news? You're likely to start feeling a severe form of morning sickness called hyperemesis gravidarum. If you suspect you may have this, speak to your healthcare provider. Round ligament pain. Of all of the pregnancy symptoms you may be experiencing around this time, this one is among the most uncomfortable. Round ligaments are two of the ligaments in your pelvis that help support the uterus, and as your baby grows during pregnancy they stretch and soften. When these ligaments tighten, you may feel pain on one or both sides of your abdomen. Changing positions in bed or doing strenuous exercise may bring on this pain. Light stretching and gentle movements may help relieve the discomfort. If this symptom doesn't go away on its own, or if you also have a fever, call your healthcare provider. Minimal weight gain. Even though your clothes may be fitting a bit tighter, you may not have gained